I am Dr. Ravindra BS, Director, Gastroenterology, Liver Diseases, Meenakshi Institute of Gastroenterology, Bannerghatta Road, and Director, Gastroenterology, Fortis Hospital, Bannerghatta Road. Malabsorption means whatever the food we are eating is not getting absorbed in our small intestine, because small intestine is the organ where we absorb our carbohydrates, proteins and fats. And malabsorption, the reasons are, these are the common reasons. One is if there are some bacteria in the small intestine, that we call it as enteritis, that is infection of the small intestine. Second is bacterial overgrowth, that is known as small intestine bacterial overload. And third being, there are diseases wherein we develop ulcers in small intestine, we call it as Crohn's disease, that is small intestine ulcers, that is number 3. Number 4, infections like tuberculosis of the small intestine, that also can cause malabsorption of the food what we eat. And number 5, if there are any polyps, tumors, and then also they prevent the absorption of the food what we eat, that's also a reason for malabsorption. And 5th and 6th being, if there is a problem in your pancreas, then we may not absorb the food because pancreatic juices are very much necessary for our digestion. These are the common reasons. To summarize, infection is like tuberculosis or small intestinal bacterial overload. Second thing is Crohn's disease of the small intestine. Third being, some people have allergy to the wheat, that is known as celiac disease. Celiac disease means in northern India we have allergy to the wheat, wherein they develop the intestinal folds, they become very flat. Then these patients, they can come with malabsorption. And 5th, rarely the tumors. And then pancreatic disorders. These are the common reasons for malabsorption. And how do these people present? They present with abdomen bloating, gurgling voices in the abdomen, and then they may pass a greasy stool. In their stools, they pass 2 to 3 times greasy stools, and then whenever they have lot of flatulence, they produce lot of gas when they pass the stool. These are the common symptoms what we see in malabsorption. And then soon they start reducing their weight, they start developing vitamin deficiencies, especially vitamin B12, folic acid and iron. Then they start developing tingling sensation in the hands and feet, they feel very tired, and then these are some of the other symptoms once they start developing different malabsorption of carbohydrates, fats and proteins, and then they start losing their weight as well. And how do we diagnose this? One is a simple blood test, that is where hemoglobin is an indication. Whether if your hemoglobin is going down, that means your iron levels or vitamin B12 levels are low. Then we check the iron level, vitamin B12 level, that is one simple way. And when we check your protein levels, they may be low, that indicates that you are not absorbing the protein. And third thing being, we should look into the stool examination. Stool may show undigested food, lot of fat, and then stool pH, it may become acidic, that indicates that there is some malabsorption. These are the simple tests, and then we look into other things. Then we do an endoscopy, look into the small intestine and take biopsies. We do colonoscopy, we enter the small intestine from colon, and then we take biopsies. And if there is problem in the middle of the intestine, we may use CT scan of the abdomen, that is known as a CT enterography. And then if there is a problem in the small intestine, we go into the small intestine with a power spiral enteroscope, wherein we can go from mouth to the small intestine and then we can take biopsies. These are the ways we diagnose this problem. Not every patient, many of the patients may be diagnosed by simple blood examination, stool examination and endoscopy. But if there is a problem in the middle of the small intestine, then we may need a CT scan or an enteroscopy. This is how we diagnose the malabsorption. And coming to the treatment part, if there is a problem like SIBO, intestine bacteria are there, we treat them with antibiotics, probiotics, then the intestine bacteria they die, and then we populate them with good bacteria, and then we put them on a proper dietary regimen so that the intestine bacteria, the bad bacteria, they don't grow. If somebody has got a problem with the wheat, said that is celiac disease, then we ask them to avoid the gluten, the wheat, and then we use other cereals for them so that this problem is sorted out. Third problem being Crohn's disease, that's an inflammatory condition wherein just like in mouth ulcers, they have ulcers in the small intestine. In this situation, there are a dietary regimen and there are drugs that we use so that these ulcers, they get healed, and then the malabsorption is treated. And then if there is a pancreas problem, then we give them pancreatic enzyme supplementation so that they are treated. This is how the malabsorption is treated at the root. And then the most important, if you want to completely treat this, then we should follow a strict dietary regimen, that is very important. And the most important thing is adequate amount of carbohydrates, fats and proteins. And then if there are any deficiencies of vitamins, especially B12, folic acid, then we have to supplement them. This is the way to treat malabsorption. in a nutshell.